and Rabies with Fumiya. Hello po! Ako po si Fumiya. We started new project and Rabies with Fumiya. Yes, and actually I'm the host in this project. Pero we have special another host. So I want to introduce to you guys. Dr. Tim! Hello po!
Hello, Fumiya. Magandang hapon.
Magandang hapon po.
It's nice to be here working with you.
Yes. Oh, are you nervous?
A bit.
A bit. Don't worry. Don't be nervous. Okay. Actually, I have a lot of questions for you because this project is I want to sharing about rabies in the Philippines. I don't know about the rabies, so that I have questions for you guys. Is it okay?
Yes, it's okay, Fumiya.
Thank you so much. So at first, what is rabies?
So rabies is a zoonotic disease. So that is caused by the rabies virus. So yung sakit na ito nakukuha, napapasa galing sa hayop. At kalimitan na nakukuha galing ito sa mga aso.
How many people are affected in the Philippines?
So in the Philippines, so based from our DOH data, there's an average of 231 deaths per year in the past decade. So that's from 2008 to 2018.
Actually, I've never heard about the rabies dito sa Japan. So are there any rabies cases in Japan?
Meron ring rabies sa Japan, and according to our collaborator, Dr. Nobu, who's working with us for the Japan project, in the 1950s, Japan also had a similar number of rabies deaths like in the Philippines. Around 200 people die from rabies each year. However, with law, they have anti-rabies law in place. So they were able to control rabies and eradicate rabies in Japan.
Wow. So what is the symptoms about human rabies?
Okay, so one of the symptoms very apparent in rabies, especially when it's in the late stages of rabies, is hydrophobia. So hydrophobia is the fear of water. So natatakot sa tubig. Yes. So patients experience hydrophobia when the rabies is already severe. Rabies encephalopathy is already severe.
So fear of water.
The patients are actually afraid of water. So they move away from water. Then for some patients, they also experience aerophobia. So this would be the fear of air. So involuntary, painful contraction of the diaphragm and respiratory, the respiratory muscles in response to swallowing liquids or a draft of air. So natatakot sila sa tubig at hangin. For the clinical course of rabies, so it usually has a long incubation period. So when the dog with rabies bites a human being, so the incubation period where there is no symptoms can last can take from 2 weeks to up to 6 years. So people don't even remember that they have been bitten by a dog with rabies. So this incubation period, the rabies virus multiplies slowly in the muscle tissues, in our muscles. Then eventually they reach the nervous system, where they rapidly spread throughout the central nervous system and reaching the brain, crossing the blood-brain barrier, thus causing the changes in behavior such as hydrophobia and aerophobia.
What should I do I don't want to get rabies?
Okay.
Yeah.
So of course, the best way to prevent rabies is avoiding exposure to animal bite. So dog bite, cat bite, and scratch bite. So you can also get a pre-exposure prophylaxis. So this would be a vaccine even before you are bitten by the dog. And if ever you are here in the Philippines to get bitten by a dog, what you need to do first as a first aid is wash the bite with soap and water and running water for 15 minutes. So you wash
15,
15, 1-5. So you wash it with soap and water for 15 minutes. Okay. And don't make the wound worse by squeezing. So don't squeeze. Don't try to make it bleed. So that's one of the common misconceptions here in the Philippines. So if you get bitten by a dog, is you need to bleed it. You need to make it bleed. So don't do that. So after washing and after adding, after cleaning it with soap and water, you can proceed to the nearest animal bite treatment center. So in the animal bite treatment center, the doctors will look at the bite and give you vaccine. And if the bite is really bad, they would also administer rabies. So this is the equine rabies immunoglobulin. Actually, so it's 100% fatal if it gets worse, rabies. However, it's also 100% preventable. So as long as you get the vaccine as soon as you can and make sure you are not bitten by by dogs.
I really didn't know about the rabies. Yeah, pero I'm so happy to new project with you, Dr. Tim. And ngayon, I think many people watching this. What do you want to say about the viewers?
I want to say that not all dogs have rabies. So rabies is also a disease. Dogs also get a disease, and one of their diseases is rabies. So rabies is something that can be passed to humans by a bite of a rabid dog, and it's 100% fatal if you don't treat it. And however, it's also 100% preventable. So we have the vaccines to prevent rabies. So I also want to share with your viewers that responsible pet ownership is very important.
Yes, I think so.
Yes. So I think you can share your experience in Japan. So in Japan, do you see stray dogs?
No. Actually, I've never seen the free dog.
Yeah, free roaming dog.
Yeah, that's why when I went to the Philippines for the first time, sobrang gulat ako kasi ang dami aso sa the street.
Sa lugar.
Yeah, sa lugar.
Yes, responsible pet ownership is very important for the eradication of rabies. So this is two sides of the same coin. So here in the hospital, we are doing the best we can prevent rabies by giving post-exposure prophylaxis. However, this can be prevented if we take care of our dogs, our best friend. Making sure that they have the complete, they have their updated rabies vaccine, so they wouldn't get that disease as well. And of course, making sure that your dogs are always leashed. They nakatali yung mga aso, very important, and that they do not roam outside your house.
Yes.
So keep them safe inside your house. If you have a fence in your home, do not let them out. And if you bring them out, make sure that they're always leashed. So
thank you so much for sharing. Maraming salamat. Thank you so much.
You're welcome, Fumiya.
Salamat. And then, this is the new project. Today, we learn about the rabies. So we have next, second, third, fourth series. Yeah, tama. Thank you, Dr. Tim. Yeah, that's why. Yeah, and I'm so happy with you. Thank you so much. Maraming salamat. Thanks so much for watching. See you next video.
And rabies with Fumiya.
Fumiya. I hope that this video will be shared with as many people as possible, and that rabies will be eliminated from the Philippines. So please share this video with your friends.